We are back on the current and got to let you know something that's happening this week. It is the National Eating Disorders Awareness Week, February 21st through the 27th. And so we're going to speak now with Dr. Stephanie Eken. She's the Medical Director of Outpatient Services at Rogers Behavioral Health. Dr. Eken, thank you so much for calling in today. We appreciate your time.
Absolutely. Thank you for having me.
So we are getting ready for, I should say it's beginning this week, February 21st through the 27th. The National Eating Disorders Awareness Week. So this is a heavy topic, but something that we really need to discuss and get some information out to folks who might be struggling with this, might know somebody who is. So Dr. Eken, I'm going to start with what you do and what your background is, how this became somewhat of your specialty.
Yes. Well, I am both a pediatrician and a child and adolescent psychiatrist. So honestly, eating disorders intersects with a lot of my background in both of those fields, because really eating disorders, I always talk about, they impact people from the tip of their head to the tip of their toes. It truly impacts every organ system in one's body. So, unfortunately, earlier in my career, not as many people worked with patients who had eating disorders. So it was really through a multidisciplinary team that I began to do this. And at Rogers, we have specialty treatment for children that includes females and males, which can be unusual. Not all places will, provide treatment for males with eating disorders because they tend to be under-recognized. And so this is something I've been doing for probably longer than I would like to admit, but with wonderful people who provide higher levels of care than what people tend to know as typical outpatient, where you go see someone maybe every few weeks. So what I currently do is see people through an intensive outpatient or something called a partial hospitalization program, where they come to us for multiple hours, Monday through Friday, and they see myself and dietitians and therapists, and we do a variety of interventions to help with their eating disorder, from therapeutic interventions, perhaps medication, certainly medical things, and then helping with their nutrition for sure to help them move forward. And what I like to say, even though this is, as you mentioned, a heavy topic, which it is, I really think the thing that I've seen change over my career is the hopefulness that we have for people to get better with an eating disorder.
Oh, that is wonderful to hear. And we definitely want to get into a lot of that today in terms of the various treatments that are available. Let's start with, and it's so interesting too, what you said about, you approach this because it does affect the entire body, and it starts in childhood usually and is sometimes in congruence with these other issues. So we'll get into all of that. I want to continue with, what different types of eating disorders are there? What are people dealing with?
Yes. Well, I think there are some classical ones that people tend to know about. Anorexia nervosa, in which people restrict their calories or may do things to lose weight, like over-exercise. So they do what we would call compensatory behaviors in an effort to lose weight. They tend to have, different thoughts about how their body looks as compared to how other people would evaluate perhaps that person's, body, and if they are at a healthy weight or not. The misnomer, I think, with anorexia that people have is that you have to appear underweight, like on a growth chart. So it's really weight loss that leads to, your organ systems having difficulty, so your heart and all kinds of organ systems having problems. So another form of an eating disorder that results in weight loss is called avoidant restrictive food intake disorder. We shorten it to ARFID because that's a mouthful. And this is an eating disorder that we refer to as extreme picky eating. Not the form of picky eating that mothers are all too familiar with when their child is a toddler and is not wanting to eat a variety of foods, often vegetables, different things. So I say don't get too worried if your child is a picky eater. It's really when they have a very small number of foods that they will eat, and perhaps they're not getting all of the food groups. Maybe they're losing protein, those kind of things, and it's resulting in weight loss. So that is a newer diagnosis that we have, although we've recognized this particular eating disorder for quite a while. There are other forms of eating disorders which may result in people not appearing to perhaps lose weight or even gain weight. And so we have bulimia, which people may be familiar with, in which someone may remain at a particular weight, but they are doing a lot of things in order to maybe try to lose weight or not to gain weight, do other things like compensatory behaviors that I've referred to before, like exercising, but they also tend to purge or what people might know as vomiting in order to lose calories, which can be very dangerous in the long term. The most common eating disorder in the United States is actually binge eating disorder, which I don't know that people are as familiar with, and is a newer diagnosis that we have. Although, once again, we've recognized it as what we call an unspecified eating disorder for many years. And so this is when people really lose control of their eating in periods of time, and it leads to weight gain and to long-term health consequences.
I want to interrupt you for a moment because I know
Yeah.
we're going through these various treatments, or excuse me, various types of eating disorders. So you've got the ARVID, which a lot of people haven't heard of. And then you've also bulimia, binge eating. We haven't gotten to anorexia yet, but I'm sure that's on the list. But you're naming these, and I just want our listeners to think about, as you're kind of describing these, a lot of the psychology that may go along with them, and it's issues of control. Everything that you're talking about is issues of control. So that spills out over into other areas of life. But I want to give that sort of framework for our listeners to think about. It's not necessarily the specific behavior, but it's the feeling of what you're dealing with in other areas. And I may be mistaken in that, but that's just what I've read over the years. There's a tie in there. So
yes, absolutely. Cognitively, there is a desire for many of them to control their environment. And in fact, for many people who have eating disorders, they have other, mental health diagnoses too, like anxiety disorders, obsessive compulsive disorder, which also have a component of control that they are looking for as well. So those often run together with these particular eating disorders. So in fact, people who we say when their brain is wired to want to have more control, that can be a risk factor for an eating disorder.
Interesting. Okay, so it's that desire to control their environment, and it doesn't mean that in all cases, because we know a lot of people who are controlling, but that could be a precursor too. And so that's what I have so many questions, Dr. Eken. So I'm going to try to stay on track here, but when you diagnosing an eating disorder is pretty simple because of the conditions that you just described. It's straightforward.
Not always.
Okay.
I mean, it is for many cases. I think the ones that can be missed are when people, like with anorexia, people always think people look really, really underweight and malnourished. But in fact, there are people who lose some weight and have all of the symptoms of anorexia, but would not, on a growth chart, appear underweight. So maybe they've lost 20 pounds from where they were. And I think that's where sometimes those, people can get missed. And then also just there's this whole range of disordered eating that happens that we don't have these very specific diagnoses to, in which people are doing really unhealthy things to their body and can keep them secret because there's a lot of shame associated with them too. And so people don't know that they're going on because they may not appear on the outside what people sort of stereotypically think of as eating disorders. So people can walk around with normal weights and have a very serious eating disorder.
Interesting. I didn't, that's something totally new to me. I was not aware of that.
Yeah.
Let's talk about what happens when someone comes to see you, goes to Rogers Behavioral Health once it's been identified, and what sorts of things start to happen in terms of, all right, we need to get a handle on this. What's sort of the treatment like at that point?
Yes. Well, we're always going to look for any kind of medical concerns as the very first thing, because I mentioned before, eating disorders affect your entire body system. So if they have not already had some type of medical workup, we are going to do that. Things like, vital signs and EKGs to make sure that medically that they are stable. And then, work with their typically their primary care doctor around those things. And then we're going to assess what is it that they are doing around their eating and perhaps exercising or other ways that they may be trying to lose weight. So we would have a dietitian meet with them as well to put together what is called a meal plan to help them, change the way that they're eating, whether it's, eating more to meet their nutritional needs, eating a wider variety, or even reducing their binge eating. And then they're going to talk with a therapist, because there are therapeutic interventions, and we definitely want the family involved, frankly, whether they're, a child, an adolescent, or an adult, because we all can use the support of our family whenever we're going through these kind of things. And so we love to include everyone and help with therapeutic interventions. So there are what we call evidence-based, treatments out there for eating disorders that we can help with the thoughts that go along with eating disorders, around people's body image, around what they think about food, and that relationship with food, which is often really distorted for these patients. And even, I talk about with families all the time, our own language. Let's say we don't have an eating disorder. Just the next time you get together with your friends or your other family members, listen to how much people talk about people when they greet them. What do they look like in their physical appearance? Oh, you've lost weight. You look great. Or, oh, I'm eating this way, or I'm, keto or gluten-free. Or, there's so much talk about body and food that people who don't even have eating disorders don't realize, and this impacts people. So we like to help people around language around food, and recognizing that there's no good or bad foods. We don't like to label foods, and just helping families with that. And then we may or may not do medications. Some eating disorders do not respond particularly well in certain phases to medications, like when people are really malnourished and underweight. Medications are not always really helpful. It's really, I always say food is the best medicine, but there are medications that can be really helpful, like in binge eating disorder or bulimia, some of the other eating disorders. So it's really this, what we call a multidisciplinary approach, to try to come at it from a variety of ways to help people have the best outcome and the best long-term outcome.
So let's back up a step and talk about when you're going through the treatment and what you're discovering and diagnosing. What is it that causes eating disorders? What is the root cause? Is it something that, for lack of a better term, that you're genetically predisposed to based on a certain personality type or condition? Is it something that a situation triggers? I'm sure it's very complicated.
It is. And I wish I could tell you there was one thing that caused eating disorders, because they'd probably be a lot easier to treat then. But we know that it's what we would call multifactorial, meaning there are a variety of things that can lead to an eating disorder. So for one, genetics can play a role. So perhaps, family members like a parent, aunts, uncles, cousins may have eating disorders. So there can be a genetic component to that. There can be an environmental component. As I mentioned, there are, if you already have a brain that we talk about that's set up for eating disorders, so maybe you want and need a lot of control, or maybe you have a lot of anxiety, those are risk factors for people. And then you're in an environment in which there's maybe a lot of diet talk or a lot of body image discussion. Those are all things that can come together over time that can lead to eating disorder. Frankly, we think about social media and what kids and adults are exposed to these days, and it's not particularly great because, one, a lot of the images are not even real images because they've been touched up in some way or another. but this is like the thing that they're looking at for comparison, right? Routinely to say, I don't look like that, or, and so I think that is very hard I would not have wanted to grow up in the world of Instagram.
No way.
As a teen. So I think that's super hard. And then, frankly, there's really scary information in a lot of platforms around here are ways to lose weight that are really unhealthy that people can easily obtain in ways that we just, weren't available at the touch of your fingers, even a decade ago.
That makes sense. I know it's so scary to think about. I have little kids, a 4-year-old and a 2-year-old. And so I'm taking every word that you're saying and I'm trying to think, okay, how can I raise them so that they wouldn't be exposed to this kind of stuff? Well, guess what? Yeah. Everybody is exposed to Instagram and all these social media platforms that just glorify beauty in a certain standard. I mean, it's gotten so ridiculous in the world we live in. Someone said this to me the other day. The Kardashians, sorry to pick on them, but they've almost made it like this one particular totally unattainable body type is the only acceptable body type.
Right. Yes. We hear these kind of things all the time for like my lips need to look away, my thighs need to have a certain amount of space between them. These are all things. I mean, these are not things that necessarily kids thought about when they, when social media wasn't as widely available. So I definitely think there are ways that the parents, I love it that you're already like, what can I do to help my child be, as healthy as they can despite these images. So there are great programs actually around like body positivity for kids now, and even just our own awareness of our
language.
Right. Yeah. When I go hang out with my best friends, I don't say things like, oh my gosh, it's so great to see you. I haven't seen you for a while. It looks like you've lost weight. Like I don't comment on people's weight. It's not for me to say because frankly, people lose weight for bad reasons too. Right. So,
right.
So I think like I just try to make those kind of things off limits. And I love it that actually some of, our stars are using their platforms too around body positivity to say like, I'm also accepting of my body and I'm not going to listen to people tell me I have to be a certain size or shape or whatnot. So I think there's some, pushback to that, but I think one of the best things that parents can do is like not talk about dieting at the table, not talk about how they're unsatisfied with their own body. I mean, I'm a 40-year-old woman. How many 40-year-old women walk around and like, oh, I wish my body looked different and I should eat a salad because I ate this at, lunch and I should make up for that. Like those are things we shouldn't be saying around kids.
Absolutely. Absolutely. And I think too, the other side of that coin is just encourage it. Well, you talked about it, the body positivity, instilling confidence, making someone feel their value beyond the physical.
Absolutely. I mean, people have so much to give that's unrelated to their body, size and shape.
I want to also discuss, like you said, we hit on the treatments and the difference that you've seen between a success story and someone who continues to struggle. What are some of the things, like you can look at everyone that who's been treated for this and say, well, these girls or boys, I don't want to say girls because sometimes it's boys too, they have this in common and they were able to beat it.
Well, one I say is as early intervention as you can. I think so many parents have a good instinct to say something's going on. Maybe I don't know exactly what's going on, but I'm concerned. So not hesitating to go talk to your pediatrician or primary care doctor if there are concerns. So early intervention is important. I also think family involvement, as much as that is possible, is an ingredient that can help people be very successful because we're asking them to do hard things. And anytime we're asking someone to do something difficult, it's always lovely and it doesn't have to be a family member, even just a support system that helps them through the process is really, really important. And then I also think seeking out that evidence-based treatment. So there are clear evidence-based treatments that we can identify for eating disorders now. And I think that's really important that people, do their research on that and go find people who specialize in eating disorders too. One of the things that I have seen happen is while there are many wonderful, therapists out there, there's many wonderful psychiatrists out there, but they don't necessarily treat eating disorders very much. And so really finding someone who has experience is important, because they are going to be able to, they're going to be up on the evidence base and what needs to happen.
I see. What kinds of signs should parents be aware of when they're afraid or suspicious that their child, suspicious sounds aggressive,
Yeah.
but they're worried about, concern for their child. What do they
Yeah.
need to look for, the signs? Because this is oftentimes secretive behavior.
Yep. Yes. So it's not uncommon for parents to get communication from a friend or even sometimes from a teacher at school that they are concerned, because think about it, your child spends so much time at school, or maybe before the pandemic, I should say that, because there's been so much virtual school for so many families. But, typically they're with their friends a lot, particularly as adolescents. So I think it's important to listen if somebody communicates with you that they are worried, number one. But also the things that you can observe on your own are a lot of negative body talk. So while, adolescents are going through phases in which they're going through a lot of changes, so they may have some negative body talk, but if that's a focus, then there needs to be some discussion about why there's so much concern around that. Skipping meals is concerning. Lots of talk about food being bad. Those are all for if people are going to be restricting. Also, exercising can be obviously good for every human but
Right.
sometimes it starts out as I want to do this for my health. And then you start to see it continue on, and they do more and more per day. And now it has to be done. And now I'm upset if I can't go work out, and it's distressing to me. That's not typical in children and adolescents to be so upset if they have to miss in those ways or to have to work out every day. I think sometimes also if kids cannot feel, particularly around with binge eating, if they can't feel satiated, so they can't feel full, and they talk about that they're always having to eat and they're gaining weight. Those are things to talk to the pediatrician about and try to explore what might be happening there. Long periods in the bathroom that are unexplained, that don't seem to make sense. They could be doing things like vomiting in the bathroom or exercising secretly in the bathroom. If you're finding exercise equipment in their room, and you're like, why is this in here? Those kind of things. Change in how they're wearing clothes. So it can go a lot of different ways, but sometimes kids will start to wear baggy clothes to hide how their body might be changing. But then some kids will also start to wear tighter clothes because they're at first excited that maybe they're losing weight and would never want to look overweight. So just any of those kind of behavioral shifts. And honestly, if their mood is shifting, I think these are times to be curious and see if you can talk with them, and you might need to talk with their doctor.
Very interesting. And I mean, as you're describing this, it just breaks my heart, because you think about kids there. It is just about trying to feel good about yourself, about your body. You want everybody to have that. So I love what you do and the way that you help people like this. And just one more reminder for our listeners where they can reach out if they need help or someone they know does.
Yes, there's numerous places that people can get help. Certainly, at Rogers Behavioral Health, we have clinics that they can help, but there are, wonderful websites that they can go to as well around the National Eating Disorder Association to just find information around evidence-based treatment so that they can seek out care. And, if they call us and they don't need as high a level of care at Rogers as what we provide, the great news is we can help refer them to places. But there's really good information on the internet too, just for people to just start to learn about what might be appropriate for them.
Fantastic. Well, thank you so much, Dr. Eken, Dr. Stephanie Eken. We appreciate your time today.
Thank you.
Thanks so much for hanging out with us this week on The Current. We really appreciate you doing that. And for everyone here at Beasley Media Group, I'm Roxanne Wilder.